campus.
Okay.
So I feel like it'd be easier. Do I have to do mine with a group, like, or with
Mm-hmm.
another person, or so I can't do it by myself?
Mm-mm. Nope. So a couple of things. First of all, welcome to class. I just started a recording. So welcome to week 3. Hard to believe we're in week 3 already. So I'll be doing groups probably later on today. I do my best to try and keep campuses together. Um, However, that doesn't always work out with the number of students I have for each campus. I don't like to overload groups. Okay, so being that this is an online class, it's also important that you work with and meet with students from other campuses. So, Caitlin, since I think you're my only Centerville student, you'll be grouped up with students from another campus. So, and it is an online project, and so um, it will require communication via email with all of you in your groups. Does that answer your question?
Yeah, I just figured because you were saying when you were discussing it, like those people could get together and work on their, and I can't get together with anybody.
Yeah,
But I can do
yeah.
is
It
communicate via online.
and sometimes they are able to get together on campus, but again, I do my best, but it doesn't always work out. And so, um, whatever group you're in, if the others want to meet on campus to coordinate their part, you're just going to have to chime in from an online perspective. Okay. So I'll be sending those group messages out, or group email out probably today, maybe later today or tomorrow. And then that's going to require somebody to take the lead in that group and reach out to everybody, and decide which parts you're going to do. But I explained that all in the um, email when I sent it out. Okay. So thank you for bringing that up, Caitlin. I'll be getting that done in the next couple of days. The other thing that I'm going to get done today, hopefully, is to open up the practice quiz or in ExamSoft. And I know you've probably seen these from other classes as well. ExamSoft has a practice exam in which you go in and take it. It's real short, but it confirms the compatibility of the devices you're using with ExamSoft. And it's always good to go through that process every term just to make sure the devices you're using are compatible with the ExamSoft software. All right, so that will be opening up probably later today, and I'll send out an announcement that that's open. Um, so I encourage you to do that. Um, I've also sent out a couple announcements with regards to our new team member this or for this term, Dr. Copteros. She's doing review session or concept review out in the hour before classes. Did anybody have a chance to attend that today? And if
No,
so, how was it?
no, but I will be attending her next one because I like her as a facilitator.
Fantastic. So yeah, as I explained in the announcements, she's offered to do a concept review in addition to the concept recording you get in the announcement, the PowerPoint, and the reading. She's offered to do a concept review in the hour prior to each class, which is fantastic. And so she reviews concepts, answers any questions for the upcoming week. So today she did it for this week. We're not recording those. It's a drop in, it's voluntary. But if you have the opportunity, if you have any questions about your class preparation and need any clarifications with regards to information and the concepts for the upcoming week, it's an opportunity for you to attend and ask those. Okay. And then I added an additional announcement. We added a Sunday night concept review for anybody that can't get to their hour before their class to drop in if they want. So there's now an additional review. So this actually Sunday concept review, Monday, Tuesday, Wednesday, and two on Friday. I just saw a chat about exam reviews. I sent you the schedule in week one for the whole term. There'll be two exam reviews. One is tonight at 10 p.m. Eastern, done by Dr. Ford, and the second one is Friday after my class at 6 p.m. Eastern time. So, um, so if everybody wants to check their schedules, I try and send that out in week one so that you can plan ahead, plan accordingly during the term of when all these exam reviews are. So first one is tonight with Professor Ford. Okay. Questions. What questions do we have? So today we'll start out by taking quiz two. And then after that, we'll review quiz two because in the rationales, you see it has a lot of the information regarding concepts. And then we'll go into any further detail with regards to the concepts after we review the quiz. But please take note of the rationales. It has a lot of good information about each of the concepts. After that, we'll do a case study towards the end of class. Last 15 minutes, I have a migrant, farm worker, and rural case study. I'll break everybody out into three breakout rooms, and the case study has three questions, and each room will have a question. And then go through the case study, answer your question in your group, and then we'll come back and talk about it as a group. Velvet, you have a question.
I do. What time is the review with Professor Ford tonight?
10 p.m. Eastern.
Oh, wow. Okay, thank you. Which, okay, thank you.
You're welcome. So for all of those that tried to open the quiz prior to 1 o'clock, you're going to have to refresh. Okay, the quiz is in there. It is open. There's an access code, and that would be my last name. So please, I'm just putting this in the chat. So please stay on camera while you're taking the quiz. When you're finished with the quiz, it's 15 minutes. You have up to 15 minutes. When you finish with the quiz, you can go off camera. And so it is 1:10 now, 15 minutes, 1:25. So everybody needs to be back no later than 1:30. How's that? Is that okay? Don't disconnect from the Zoom. Just go off camera. Don't log off. Stay on, but make sure you submit it when you finish it. Okay? Is everybody seeing the quiz? And enter the access code and you're free to get going. And let's stay on mute. So if you have any questions, put the questions in the chat. And I'm also going to go on mute as well. Okay? All right, it looks like everybody has finished taking the quiz. If you would back on camera, please. Shakira, Samir, Takira, if you could put your cameras on. Aisha,
My camera is on. You don't see me?
who's speaking? Yep.
Okay.
Who is speaking?
Akira.
No, I can't see you. There you are. Yep. No, Shakira, no, I can't see you. No, I can't see Aisha, Shakira, and Takaria.
They might have stepped away since you said to come back at
Yeah.
1:30. Yeah.
Yeah. Okay. While we're waiting for them to get back, how'd you do? Were you able to take the opportunity in preparing for class to watch the Concept 3 recording that I sent and have a look at the PowerPoint? And all your readings, as you know, from this week were embedded in the modules. There were no book readings this week. And I tried to give a fairly decent overview of the concepts in the concept recording, so hopefully you had a chance to watch that. Let's see. Okay, I'm going to go ahead and pull up the quiz and we can review it. Did you see the rationales? Are those rationales helpful? Anyone?
Yes, the rationales are very helpful. Yes, they are.
Okay. Okay. Everybody see my screen? Can you guys see my screen?
Yes, Professor.
Professor.
Thanks. Okay, so this week we talked about migrant farm worker. We'll be talking about migrant farm workers, rural populations, homelessness, and poverty. Okay, this first question talks about, in general, what should you observe? What should the home health nurse anticipate about clients in a very rural community? Let's take a look at the rationale first. It gives a good overview of rural communities. We know that in rural communities, rural adults are less likely to prioritize their health and engage in preventative activities. They're more likely to smoke, have higher rates of alcohol use, obesity, less likely to engage in screenings and wellness visits. They're much more likely to have chronic illnesses like heart disease, COPD, hypertension, arthritis. Nearly 50% of all rural adults have been diagnosed with at least one chronic illness. That's really a high rate. So why is it that you think, through your preparation, why do you think rural adults are less likely to prioritize and engage in preventative activities? What do you think?
Undereducated.
Undereducated, yeah. What else?
Further access.
Access is a big issue.
No transportation.
Transportation is a big issue, yeah.
They work too much and don't take time off to go to the doctor.
Correct. Yep.
They work
Yep.
for themselves.
Yep. Lots of barriers for the rural population with regards to healthcare. in their health status. So one thing, the correct answer is obviously A, they're more likely to have complex chronic illness because of some of the things that you just mentioned. Okay, maybe lack of access. Remember, in the rural communities, a lot of these jobs in the rural communities are very low paying jobs. They tend to be hourly or daily. And lack insurance. Okay, so if people in the rural community need to take a day off to go to drive distances to go for medical appointments, it may be a day that they don't get paid for. Okay, they are much less likely to prioritize their preventative health. So B, most of them will have employer provided insurance. That's not true. Most of them will not have employer provided insurance. Will they be less likely? They'll be less likely to have environmental chemical exposures. That's actually the opposite. One of the big risks, and we'll talk about that in a different question, but one of the biggest risks for the rural population, migrant farm workers, is that they do have an increased chemical exposure because of the environments they're working in, pesticide exposures. Okay. And then most of them will have adequate access to physicians. That's actually the opposite. Most of them will not have access. Typically in rural communities, there's very limited healthcare workers. Okay, there may be a family physician, maybe a practitioner, maybe a general practitioner. But as far as specialty, OB, cardiology, neurology, all the specialty areas, those aren't in the rural communities. They will have to drive distances to get to those services, to access those services. Okay. In this rationale for the second question, I put a review in for primary, secondary, and tertiary. So as I said last week, on the quizzes today and going forward, there are primary, secondary, tertiary questions on the quizzes, and several on each exam, and there are several primary, secondary, tertiary questions on the HESI. So I wanted you to have this rationale if you need to refer back to it. So we know that primary P is for prevention. We're trying to prevent something before it occurs. Okay. S is secondary, which is screening. So we're trying to early identify at risk. We're trying to identify risk, early identification, early intervention. Okay. So we're trying to, when we can identify something early, we're trying to attempt to reverse the course. Right? Preventing whatever's going on from going further. And then tertiary is treatment. Okay, something has to be going on. There's been an illness, an injury, an accident, a disease, a condition, and now you're trying to treat it or manage it. Okay. So, in looking at this question, the nurse is developing a primary prevention program for members of the rural community. Which intervention is appropriate? Well, B is the only primary answer, right? Providing information on minimizing excessive sun exposure. And we know that in the rural communities, a lot of people are working in the agricultural industry or outside. And so we're trying to prevent any issues with excessive sun exposure. So providing information or minimizing sun exposure is a primary prevention, trying to prevent something before it happens. What is A, primary, secondary, or tertiary?
Secondary.
Right, it's a screening, right? A pap smear is a screening. What about C? What is C?
Tertiary.
Tertiary. Yeah. And why is it tertiary?
Because it's an existing problem.
Right. The client has diabetes.
Yes.
Exactly. Right. And how about D? What's D?
Secondary.
Secondary. Screening.
Yeah, secondary.
Okay.
Screening.
Does anybody have any questions about primary, secondary, and tertiary at this point? I know it's early and we're just getting started, but wanted you to have a good understanding of what each one of them are and be able to identify which interventions would be at which level. And remember, as I said last week, education happens at all three levels, right? So don't think that education is only at the primary level. We're educating to prevent, and then we're educating at the secondary level. Once we identify risk, we're educating on how to minimize that risk or reverse that risk. And then education at the tertiary level, we're educating on how to treat, how to manage that disease. Okay. Okay, the third question. Migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, cough. Which nursing intervention is appropriate? Well, if we look at what who our population is, the migrant farm workers, and we look at what their risks are, as we learned, one of their biggest risks is pesticide exposure. And so complaining of bilateral eye irritation, throat irritation, and cough, those are symptoms of acute pesticide exposure, which is why the answer is asking the farm worker if they apply pesticides at work. Okay. We look at the rationale, and we need to know this because you're going to get asked about this in exam 1, right? A scenario. Is it given a scenario, a client scenario? Is it acute or is it chronic? So let's look at this. So pesticide exposure is a very big risk in the rural populations. Okay. Pesticide exposure can be looked at in 2 ways. Has the client had an acute exposure or chronic? Acute, in your rationale, memory loss, difficulty concentrating, mood changes, abdominal pain, nausea, vomiting, diarrhea, maybe skin rashes, eye irritation, throat irritation, headache, confusion, twitching muscles. On the other hand, people who have had chronic exposure over a period of time, there are different symptoms. Maybe birth defects, cancer, blood disorders, neurological problems, maybe reproductive issues, Parkinson's-like symptoms, infertility, sterility, polyneuropathy, liver damage. Okay, those are chronic. So please understand the differences between acute and chronic. And going back to the question, evaluate other families for signs of conjunctivitis. These symptoms presenting in the question are way more than conjunctivitis, correct? Okay. C, we are not treating. We don't treat. So request a physician's order for antihistamine. We don't diagnose and we don't treat. Okay, so that would be inappropriate, right? And complete a TB symptom screening questionnaire. These are not symptomatic of TB, so that would be an inappropriate answer. Any questions on that question? Okay, during a home visit, the nurse notes that a migrant farm worker's family, they're living in a very small house with several other families. Which nursing assessment is a priority? What's the important word in this question?
Priority.
Priority. This is a priority question. Okay, this could be an example of a question where maybe another answer looks like it might be correct as well, but it's not a select all that apply. So you have to go back and look at the question and see if you missed a particular word, cue, or phrase. So when you're reading through this question, we know that the population is your migrant farm worker. We know that living in a small confined area with several other members. From your concept recording and concept review and readings, what is the potential risk of the migrant farm worker living in very crowded conditions? Okay, this is a potential. We have to be concerned about TB, GI, hepatitis. Let's look at the rationale. When migrants arrive at the farm to work, they may find that housing is not available or that's substandard, lacking sanitation, structural defects, mold, lead, broken appliances, lack of climate control. Some migrants live in cars or tents. When housing is available, it tends to be overcrowded. okay, which contributes to the risks of TB, gastroenteritis, hepatitis. Older housing exposes residents to lead. Housing may be located near fields where high concentrations of pesticides or herbicides threaten the health of their families and whose children are at risk for injury. Okay, so that's when we identify the population in the question and identify the environment, migrant worker and crowded living conditions, a priority assessment is to do a TB symptoms screening questionnaire. Okay. Does anybody have any questions about that question? Okay, the next question addresses poverty, which is one of the concepts from this week. Which statement reflects the impact of income on health outcomes? Let's just talk about poverty in general. Okay, what are the risks associated with poverty?
They don't have enough money to go to the doctor.
Okay. What are the other risks associated with poverty?
Homelessness, joblessness, so they won't have any insurance.
Mm-hmm. Mm-hmm.
Stress,
Yep,
mental health issues.
exactly. Okay, we know that poverty leads to chronic stress, mental health issues, high rates of chronic illnesses, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, more significant disability related to those chronic illnesses, and higher rates of hospitalization.
It also said higher rates for the substance abuse users, and that was due to the fact that they don't have any like rehab facilities and things like that they need to be able to deal with getting over it.
Exactly. The limited resources and support for substance abuse, alcohol abuse, mental health treatment. Okay, so what statement reflects the impact? Well, low income poverty increases the risk of chronic illness because of all of the things we just talked about. If you look at answer A, low income guarantees access to Medicaid. It doesn't. You have to qualify for Medicaid based on a certain income. Okay, what if you're right above the poverty line? We'll address that in the next question. So low income does not guarantee access to Medicaid. High income reduces the attendance to wellness visits. Actually, that's the opposite. High income increases the attendance to wellness visits because you have the means and the resources to get to those visits, correct? High income does not improve health outcomes. It does. Again, you have access to resources that people living in poverty may not. All right, so high income actually does improve health outcomes. So what should the nurse anticipate for family living just above the federally defined poverty line? What happens once you live above the federal poverty line? What happens?
Just a lot of lacking of resources.
Right.
Are vulnerable to all type of things.
You can no longer get state insurance either.
Exactly. Exactly. So people living below the poverty line have access to a lot of resources, and it's in the rationale here. TANF, public housing, food stamps, Medicaid, WIC, Head Start.
But that information you gave us, it stated like maybe they possibly could be undereducated or they don't have internet or just certain things to even gain access to those resources.
Right. Right. And that's an issue. That's a big issue. Yeah. This question is asking what happens if let's say you're slightly above that poverty line. Well, you now, like Andrea said, you now have an increased vulnerability due to fewer community resources, right? So, and as Caitlin said in your readings, there's a lot of other challenges living in poverty. right? People may not have access to even apply for these resources. Okay, so how can we as community nurses assist them with getting those resources to be able to apply for these programs? Okay. Okay, which client is at the highest risk for adverse health outcomes related to poverty? What's the important word in this question?
Highest?
Highest. It's a priority question. Okay, we know from our readings and preparation about poverty that we know that kids are at the highest risk for effects of poverty for many reasons: lack of nutrition, poor brain development, exposure to environmental risks, toxins, trauma, abuse, low quality daycare, low quality education. Okay, so this is a question that it's not that all of these 4 answers are not potentially at risk for adverse health outcomes created by poverty, but it's asking which is the highest. And because children are at the highest risk, that's why A is correct. It's not that the other 3 are not at risk, but the question was asking who is highest at risk. Did you guys catch that? Okay. Another poverty question. Which would the school nurse expect from an impoverished adolescent? Okay. Poor teens, we know, are much more likely to have below average academic skills, and they're actually 3 times more likely to drop out of school. They have higher rates of teen pregnancy, and they're more likely to suffer the complications with pregnancy, whether it's late prenatal care, lack of prenatal care, low birth weight, preemie babies, maybe even babies with birth defects. So we would expect, best answer would be the increased risk of dropping out of school. If you look at A, reduced risk of unintended pregnancy, that's actually the opposite, right? There's an increased risk of unintended pregnancy. And they certainly excellent use of adaptive coping mechanisms. They're going to have a more limited use of adaptive coping mechanisms. Sorry. Improved attendance to extracurricular activities? No, it will be decreased attendance. Okay, for the teens living in poverty. And then which client is at the highest risk for homelessness? What's the key word in this question?
Highest risk.
Highest. Okay. Why is B the correct answer? What stands out in B as being the correct answer?
The PSTD, the post-traumatic stress disorder.
Know that they're alone.
And they're alone.
And alone, yeah.
And they're alone. If you look at the other answers, yes, they are at risk. However, they look to have some kind of a support system in place. Okay, whether it's a supportive family, living in group home setting, older child with a history of suicidal ideations, the veteran living alone is the highest risk. It's not that the others aren't at risk, but who is the highest? This rationale gives a good introduction into homelessness. Okay, homelessness includes those on the street, but also those staying with friends or relatives, staying in temporary shelters, staying in institutions temporarily. And the key is they have nowhere to be discharged to. Okay, some individuals have intermittent homelessness. They go in and out of periods of homelessness. Because of these factors, it's hard to accurately estimate the number of homeless individuals. I know in your reading page in Canvas, some of those numbers were given, but as estimates. Okay, we know that homeless people are exposed to the elements. They live in crowded and unsanitary living conditions, often malnutrition, lack of sleep, chronic stress. We know that homeless the homeless population is more at risk for substance abuse, alcohol abuse, combined with mental illnesses. They're at high risk for TB, skin infestations, chronic illnesses, and are at risk for being victims of crime. Right? Trauma is a major cause of death and disability with the homeless. Maybe they've experienced gunshot wounds, stab wounds, head trauma, suicide attempts. And interestingly, the life expectancy of a homeless individual is 44. That's low. That's very young, as opposed to 78. Very young. And we'll go through homelessness a little bit more detail as soon as we finish up with the quiz. So the nurse is working at an outreach clinic at a homeless shelter. What clients should be prioritized? What's the key word?
Prioritize.
Prioritized. Okay, so our population is a homeless. Our location or environment is a homeless shelter. We know that living in a homeless shelter puts you much more at risk for TB. Okay, so the reason why is A the correct answer? It's not that all these 4 scenarios don't need to be assessed, but we're asking.
Is it because they are symptoms of TB?
Correct. And we need to determine if there's any kind of a potential TB outbreak. It's not that the client with the worsening foot ulcer and purulent drainage doesn't need to be assessed. Of course they do. Right? Same with the answer C, same with answer D. But the question is asking you to prioritize. And because we know what our population is in the environment, we need to assess whether somebody has TB, because TB outbreaks can be common in homeless shelters. That's why that answer is correct. Does anybody have any questions about that? So let me bring up our PowerPoint. Anybody have any questions about the quiz before we go into a little bit more detail with each of the concepts?
Professor, going forward, on the quizzes, do you want us to read? I mean, some of the content to me was in week 3. So the quizzes should, I mean, I know we need to read to prepare for the class.
Mm-hmm.
So the quiz, I noticed some of the contents were in week 3.
Right, but the content was also in the concept recordings, the recording that I sent out, and in your readings. I tried to cover the content, or at least the content of the quiz, in my concept recording.
Okay, got you.
Does that make sense?
Yes.
Okay. So our first migrant farm workers. Who in the rural migrant community? Who are the rural migratory and seasonal workers? So what do these migrant farm workers look like? What do you think? Who are they? Where do they come from? How long do they stay? What is a migrant farm worker?
I would say probably mostly young men who've traveled from another place.
Okay.
I want to say immigrants.
Okay. So migrant farm workers come to the U.S. to work on farms during necessary seasons, and they go back home. They are moving around a lot. Okay. They usually don't know what services are available to them. There's often a language barrier that can make accessing healthcare or communicating health concerns even harder, right? They typically don't have private vehicles. Okay, so transportation is an issue. We know that female migrant workers have a higher risk of sexual harassment and abuse. A lot of times migrant workers bring their families. So you have children working on the farms. Okay. With that comes increased risk, right? We want children working on the farms to be performing short, simple tasks and not have the exposure to the sun. Okay, we try and minimize their exposure to chemicals. Okay, we know that our U.S. food supply would collapse without the work of the migrants, right? It's estimated that 2 to 3 million of these workers are in our farms seasonally. Okay. We talked about about the housing issues. We talked about the migrants are also at risk for chronic diseases. Okay, they're at risk for diabetes, poor dental health. They're at risk for obesity. They're at risk for mental health issues. They're at risk for substance abuse. Kids have additional risks: malnutrition, infectious diseases, dental issues. Maybe they have inadequate immunization status. They're at risk for pesticide exposure. They're at risk for accidents or injuries if they are asked to use tools, or certain parts of the roles that they have on the farms. They're very much at risk for accidents. Their schooling has often been disrupted, right? As is their social environment. They have been pulled away with their family for a certain period of time. Okay, so school is disrupted and their health is very much challenged. There is what's called a Migrant Health Act. Okay, it provides supplementary health services to migrant workers. Okay, and these are outreach clinics. There's approximately 154 clinics located in 42 states, and it serves about 3 million people. Okay, so there is access if you're working in one of these states that has the outreach clinic specifically to migrants for the outreach of healthcare. Okay, we talked about some of the risk of farm workers, right? Pesticide exposure, heat and sun exposure, using hazardous tools and machinery, increased risk of infectious diseases. We talked about that. Increased risk of TB, hepatitis, GI issues. Okay, also musculoskeletal issues, the long hours of lifting. Okay, respiratory illnesses, skin disorders, eye disorders. Talked about very high risks of depression and maybe neurological problems. That was in one of our rationales. Onset of Parkinson's due to the chemical exposures. And then I asked you to review and please be aware of the pesticide, acute and chronic. Okay. Common health concerns, barriers. Okay, we talked about those. Common characteristics, that was in our rationale from the first question in the quiz. Common characteristics. What are the common characteristics? Less likely to seek health care, or at least primary health care. Okay, very focused on their day-to-day living, not thinking long-term about chronic illnesses. We talked about access to healthcare in rural communities. What are the barriers? There's an excellent list of barriers in your reading page for rural populations. What are some additional barriers? Talked about transportation, potential language barrier, maybe poorly paying jobs without insurance so they can't afford to leave their jobs for a day. What else? What were some other barriers from your reading page? This is a big class and there's not a lot of participation. So does somebody want to go back and review the reading page and pull it up in your module and talk about some of the other barriers?
On the homeless, Professor?
Well, if you would just mention a few that are on there that we haven't talked about.
Okay.
Did you say work shortage?
Work shortage. Yeah, it's very hard to recruit healthcare workers for the rural community. We talked about this during the quiz that typically a rural community has very limited healthcare coverage, right? Maybe a family physician, a general physician that sees the whole community. Maybe doesn't have a specialty in any background.
It also stated with physicians being in the area for a long time and then they go to retire, they don't have anybody to stand into.
Exactly.
So all these families have been going for years.
Exactly. And if you look in your rural populations reading page, it gives you some pretty interesting graphs about where the deficiencies are in coverage for healthcare. Whether it's for mental health, whether it's just general practitioners. There's a lot of gaps. It's several purple and white graphs for you to take a look at. We know that another issue is poor literacy. Okay. What do we mean by poor literacy? It may be lack of education, maybe lack of understanding or comprehension of what's going on, what their diagnosis is, how to communicate their symptoms, how to comprehend.
It also broadband access, like telehealth.
Yeah.
issues.
Yeah. That's another big issue in the rural population is limited internet access. Not everywhere, but in some areas, very limited internet access. So that creates a problem for maybe trying to create telehealth visits so that they don't have to drive an hour away to a specialist, that they can do a visit over the phone. So those areas with limited internet access, that's not an option.
It says home health issues also, like getting home health nurses, hospital,
Exactly.
palliative care.
Yep. Yeah.
Also social stigma, privacy issues.
Yep. That's a big issue in the rural populations, the lack of anonymity.
Mhm.
Everybody knows your business, right? Which is one of the reasons why a lot of people in the rural communities don't come forward with sensitive issues of alcohol abuse, substance abuse, domestic violence, child abuse. Okay. A lot of times those kinds of issues are not addressed until they're serious enough that somebody has to go to a clinic or a hospital or urgent care. Right? Because afraid of the stigma of everybody knowing their business, since rural communities are typically very tight-knit, small communities that don't really want a lot of interaction from the outside. They like their communities, just their communities, to stay together and know what's going on. Okay, homelessness. What do you think? Care of homeless in the initial approach. What do I mean by that? One of the things we talked about this in, I think maybe last week, maybe we haven't talked about it yet. When we talk about caring for vulnerable populations, we need to consider our own thoughts and feelings and
Are you
beliefs.
trying to talk about stereotyping, like we would
Yeah.
stereotype them?
Yep. That's what I'm talking about. Yep. When we care for our vulnerable populations, it's always important. I think next week we'll talk about the LGBT community, and we talk about this. How do we approach the community with compassion, empathy, and willingness to show that we care about their health concerns? The same applies to homelessness or people with mental health issues, people with substance abuse issues. So when we're caring for the homeless and a lot of other vulnerable populations, what's our initial approach?
To try to gain trust with them.
Exactly. Exactly. And how do we gain trust?
Getting to know us, getting to know them, just building a good rapport with the two of us.
Right. And that's our initial approach to working with lots of vulnerable populations. The initial approach makes all the difference, right? Trying to come across in a caring, compassionate way that we care about what's going on with them. We want to help them. There has to be trust developed, and you'll hear that brought up a few times over this term.
And not being judgmental.
Not being judgmental.
Fixing your face. Some people don't know how to fix their face when they're trying to conversate with someone in the situation.
What does that mean?
Like they'll make facial expressions, like when your patient's in pain and they're grunting. Say you have someone that comes in, they're homeless, they're dirty, they smell. People make faces, you know what I mean, and then they can know off of how you're feeling from your body language. Nonverbal.
Your nonverbal communication makes a big difference. Who's affected by the homelessness? Who can be homeless?
Anybody.
Anybody. Yeah.
Anybody can be homeless. Any age, any race, any gender, any occupation. Right? What are some risk factors for homelessness? I think we might have addressed some of these, but what are some risk factors?
Loss of employment.
Unemployment.
Mental health.
Mental health.
Safety
issues.
Substance abuse.
Veterans.
Insurance. What else?
Abuse.
Substance abuse.
Disabilities, just in general.
Disabilities, yeah. That's a great overview. There's lots of risk factors. I mean,
it says hunger, abuse, neglect, separation from their family, poor nutrition.
Common clinical and medical conditions with the homeless: cardiovascular disease, dual diagnosis, maybe a substance abuse issue with a mental health issue. Common to have cognitive disorders, TBIs. What happens with the homeless population? We talked about this in one of our rationales: injuries and violence, preventative health issues. This is a group that does not seek preventative care. When you are able to finally see and treat a homeless individual, they're usually at a much more advanced stage of their condition or their disease. Common for infectious diseases and sexually transmitted diseases. We talked about skin and foot problems, exposure-related conditions, heat, cold. In your reading, there's an excellent table that it lists out numerous resources for homelessness.
Which book is that, Professor?
It's in your reading. It's in your page reading in the module. Your homeless page.
Okay.
Yeah.
Okay.
There was no book reading this week. Everything was in your module. Okay, poverty. Okay, we talked about definition of poverty, contributing factors, geography of poverty. There's also a chart that talks about the geography where it's most common. Health issues common to living in poverty. We talked about those. Chronic illnesses. We talked about chronic stress, mental health issues, high rates of chronic illnesses, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, more significant disability related to those complex health problems. Now, and the effects, we have to think about the effects of poverty on young kids, adolescents, and teens. They all react differently, right? And I saw this in the schools when I worked in the schools, families living in poverty, families that were homeless. There were very distinct differences in the way the younger kids handled it, the middle-aged kids handled it, and the high school kids handled it. That all has to be considered. What if you're working with a family that has kids in each of those age groups? Right, so what can we do? Last question. What can we do as nurses when caring for this population?
Give them resources, things that'll help them with like clothes and food and the holiday shelters and things like that.
Exactly. We as community nurses, whether you're working in the schools, whether you're working in neighborhood clinics. We have to have the resources. We need to be knowledgeable about the resources available to these populations, right? Each family may need different kinds of resources, but Caitlin just identified several different kinds of resources they may need: shelters, food banks, clothing banks, maybe internet, maybe the ability to apply for resources, right? Okay, so that's an overview, or that's a overview of the concepts from today. I'm going to break you up into 3 groups. I sent out the case study in your announcement. Okay, so everybody seeing the case study? And can you access it? And only, well, if you pull the case study up. Do you see the case study? Fantastic. Okay, so I'm going to assign you into 3 groups. Group room 1, if you could answer question 1. Room 2, if you could answer question 2. And room 3, if you could answer question 3. And we'll just stay in our room for maybe 5 minutes, 5 to 7 minutes, and then we'll come back and we'll talk about each of them. And I have a I have the case study that has the answers and the rationales that we'll work through when we come back. Okay, so go into your breakout. Pardon me?
How are you doing the groups?
Pardon me?
The groups, how are you doing them?
I'm doing them right now. I'm opening the 3 rooms and you're all assigned to a room. Answer your question, talk about it amongst you, answer it, and then we'll come back and talk about it in about 7 minutes. Okay? So you just have to accept the invitation when it comes. I just sent it. So accept your invitation to join your room, and somebody has to have the case study pulled up, or you should all have the case study pulled up. Maimuna, do you want to join your room?
Populated city. It is located with residency. Sorry. Many of the large farms have houses.
I was in class with said she said they usually won't go for like mental health help and things like that. They come.
Mm-hmm.
That's nicotine poison.
All right, I got it. I think it's also gonna be D. Eye problems related.
Were you able to come up with your answers? I give you enough time?
Yeah.
Yes, Professor.
Let's just wait for the rest of the group to go back in. Okay. So what I'm going to share with you is the the version of this that has questions to consider. Okay. I'm going to when I share the recording of this lecture with you, I'm going to share this document with you so that you have some questions to ponder. And the case study also has the answers and the rationales. All right. So I'll share this document with you so that as we go through it, you'll be able to go back and review it as part of the rationales set have some good information and additional teaching about migrant and rural populations, migrant farmers, rural populations. So room 1. So we have a nurse, well, all of you. We have a nurse working in the public health department. She's assigned to the rural health clinic. She serves largely Hispanic population with many migrant farm workers who are primarily male, right? This community, the town she serves is approximately 45 miles from the nearest densely populated city. It's located within a farm residency. Many of the large farms have housing quarters known to be occupied by undocumented workers. Farms are situated within fields, grapevines, peach orchards. Okay, so room 1. As a public health nurse working in the rural practice, what are some of the professional challenges she may encounter? Did you come up with C?
Yes.
Yes.
Yeah. I mean, one is not really a challenge. Okay. She is going to get a diversity of clinical experiences. Okay. She is, because she's in rural nursing, is going to have close relationships with her clients. Right. And as a rural nurse, she is going to have a lot of autonomy, meaning that's it. It's her. So she's going to have a lot of leeway to make decisions. What she will lack is resources and relationships with other professionals to interact with. So let's look at the rationale, because we didn't really address this talking about the rural health worker. Some of the challenges of rural nursing practice include professional isolation, limited opportunities for continuing education, lack of other kinds of health personnel or professionals from whom they can interact, heavy workloads. They're it. Okay. The ability to function well in several clinical areas, they need that, right? They could be taking care of pediatric patients, adult clients, elderly clients, right? Lack of an anonymity. We did talk about that. Okay. And even with the healthcare workers, there's a lack of anonymity with regards to them as well. And for some, maybe a restricted social life. There isn't a lot to do in the rural communities, right? As we know, many nurses value the close relationships with clients and coworkers, along with the diverse clinical experiences that evolve from caring from clients of all ages who have a variety of health problems, caring for clients for long periods of time. Sometimes one of the students mentioned, I think it might have been Caitlin, several generations. You may be the physician in this community or the nurse in this community for several generations. Okay.
I mean, my family doctor's been our family for 40 years. She still
There you go.
practices, but when she leaves, you know what I mean? She's taking
Yeah.
care of almost 5 generations of my family.
In a rural setting.
No, more of a city setting, but still, she used to be in a royal setting and now
Yeah.
she's in the city, but still, you know what I mean?
Yeah.
She's very small, not a lot of people know.
Sure. Thanks for sharing. Number 2.
We
Did
got
you come
D.
up? You did come up with D.
Yeah,
Okay.
we fought between B and D because, just hearing from other outside sources about certain things, but ultimately we came up with D because the way the
The
question
language
is
barrier and
worded,
stuff.
we
Yeah.
don't think they properly understood. So they're just nodding in agreement in the situation because they don't know what's really going on.
Excellent analysis. Okay, so this question is about, in particular, the Mexican population. And the rationale gives you an excellent overview on culture, values, practices of the Mexican community, right? Well, we know that the nurse is considered an authority figure in general, and that we should be able to respect the individual, be able to relate to the individual, maintain the individual's dignity, and I'll add on to this sentence, irregardless of what culture they are. Right? Because as nurses, over the course of your career, you are going to be working with and interacting with many, many different cultures. And we'll talk about this as the term goes on, but I really focus on cultural competence. Okay, to be culturally competent, we don't have to know everything about every culture. And when we don't, what are the strategies that we can employ to learn?
Ask questions from them themselves.
Ask, do your own research, participate in activities in your community as the community nurse that might be part of their culture.
Yesterday in leadership, she said we kind of got to get comfortable because some people aren't very comfortable talking about other people's spirituality and their religion and their beliefs and things. So we got to get comfortable with doing that.
That's exactly right. And we started to address that a little bit earlier about, and it will come up next week in more detail, but we need to do our own personal inventory, right? We need to do our own before we can be culturally competent, one of the first things we need to do is a personal inventory of all of our biases, potential prejudices, potential judgmental thinking, right? You aren't going to be able to be culturally competent until you are knowledgeable and can accept that different cultures have different values, different practices, different beliefs, different communication styles. And as this rationale explains about the Mexican population, look at all these tips about the Mexican individuals. They prefer polite, non-confrontational relationships with others. At times, because they're simpiada, individuals may appear to understand what's being said to them by nodding, okay, when they actually do not understand. Okay, nurse should take measures to validate the understanding of these individuals. Okay, this particular population expect to talk about personal matters, kind of chit-chatty, for the first few minutes of the encounter. They expect the nurse not to appear rushed and to be a good listener. Humor is appreciated. Touching and caring, touching as a caring gesture is seen as a positive behavior, while in other cultures, touching is a negative, considered negative. And so as you go along working with different cultures, you'll begin to gain a wealth of knowledge into particular values and beliefs and practices of each culture. Okay. Then room 3. So one of the clients works in the grape fields for 12 to 13 hours a day, responsible for picking food, packing, moving crates for being picked up. What would be the primary health concerns? Did you come up with C, D, and E?
Yes.
Yeah.
Yeah.
Yes.
Yeah, let's look at the rationale. So the physical demands of harvesting crops for this particular population take their toll on the musculoskeletal system. Back and neck pain, most common types of chronic pain. Reported working with many workers leaving or changing their jobs. Okay, we know that naturally occurring plant substances or applied chemicals can cause irritation to the skin. Okay, contact dermatitis or eyes, allergic reactions, chemical conjunctivitis. We know that green tobacco sickness, which is dermal exposure to wet tobacco, was experienced in 50% of the tobacco workers in North Carolina, which is where this case study came from. Eye problems are often caused by exposure to chemicals, dust, pollen, and lack of eye care because of unavailability of resources in these kinds of communities, right? That can lead to chronic eye problems with loss of vision for some individuals. So, this case study just, I think, reinforces what we talked about those two particular populations. I'll send that along so they can use that. You can also use that as an additional resource when preparing for the exam next week. I would also encourage you to use your 2 quiz rationales, two quizzes and all the rationales as part of your preparation for your exam next week. If you can attend one of the reviews tonight or Friday, that'd be fantastic. If you can't, you will be getting both recordings. Those will be posted in your announcements, so you'll have the recordings. And then you won't be testing till next Tuesday. And so after you do your due diligence in preparing for the exams, over the weekend or next Monday, if you're still struggling with any of the concepts after you've listened to the reviews, you're still struggling with any of the concepts, reach out to me and we'll schedule a tutoring session to answer any of your questions that you might have. I want you to be as prepared as possible for the exam. And you do have a lot of resources to prepare for the exam, right?
Are you going to be giving out like a physical concept guide, or are we just going to go based off the reviews?
What do you mean?
So like our other instructors will physically like email or put in the announcements an actual concept guide or, practice questions or whatever it may be that they do.
So I gave you a concept guide and a review guide in week 1.
I was supposed to say I didn't see it. I was looking. I'll go back to week 1.
Well, that concept guide lists all the concepts on the left-hand side. for weeks 1, 2, and 3, but the boxes are blank. The expectation is, and I explained this in week 1, the expectation is
To
that you're
fill them
taking,
in, I forgot.
the expectation is that you take notes in those boxes of the important points we brought up of each concept. And then once you get to the review or listen to the recording, I have put additional information into those boxes that I bring to my review with me. Review this, review that, review this, right? And then what I'd like you to do is just combine those notes. Combine the notes you've put in, because again, you're building your own study guide. And then you can supplement that with the information we provide in the reviews. Okay, so my review document is the same as yours, except mine has information in it about things to review, which hopefully you've already put in your box. Okay, so it's combining those two. Okay, so if you can't get to my review, I would highly suggest you listen to it. Okay, on Friday. So,
Friday is 8 o'clock.
pardon me?
Friday is 8 o'clock, the review?
Nope, Friday's 6 o'clock.
6.
There's one tonight at 10 o'clock with Professor Ford, and there's one Friday at 6 o'clock with me.
Okay.
And if you can't attend them live, you'll get the recordings once they become available. Okay? Do you have a better understanding of our 4 concepts that we covered today?
Yes.
Okay. Okay. Well, I hope you all have a good rest of the week. Please reach out with any questions that you might have. And if you need some help after doing your preparation for the exam, if you need any help over the weekend or next Monday before the exam, just reach out, okay? Please. All right. Have a good rest of the week.
You too.
Thank you, Professor.
Thank you.
You too.
You're welcome.